Here is a story about a medical condition that you may not have heard about before. A bezoar is a mass found in the stomach consisting of undigested materials. There are 5 types of bezoars. I described several of these forms. Clara had been overweight from her childhood and adult life. She was a biomedical engineer for a company that produces equipment for clinical labs. She tried all sorts of diets which produced short-term results. She enrolled into aerobic classes, yoga, Pilates, but after a few months, she suffered joint pains from her exercises and stopped. She contacted her doctor about the possibility of weight loss surgery, and she was referred to Dr. Moreno, a gastrointestinal surgeon. Dr. Moreno explained the different types of procedures for weight loss. After a month of reflection, Clara opted for bypass surgery. Dr. Moreno sewed a piece of her intestine from the top of her stomach directly to her small intestine, enabling some food to bypass her tummy. After recovery, Clara was discharged with a script for opiates for pain management. She quickly began to lose weight. Months later, however, she began experiencing stomach pain, nausea, and vomiting, and went back to Dr. Moreno. About the same time, Norman, a clinical lab director at the General Hospital, started experiencing abdominal pain. Both Norman and Clara were referred to radiology that same afternoon. Coincidentally, they knew each other as Norman's lab uses some of the instruments provided by Clara's company. After their visit, they saw each other in the parking lot. To their surprise, they both had bezoars. Clara revealed that she had bariatric surgery months earlier. The radiologist told her her pharmacobezoar was due to GI obstruction and reduced gastric motility. Norman didn't know how his developed. Both patients' bezoars were removed by laparotomy. The bezoars and fresh urine samples were sent to Norman's toxicology lab. Clara's mass was golf ball sized and contained opiates. Her urine was also positive even though she stopped taking morphine a month ago. Norman told Clara on her next visit that the word bezoar comes from bazaar, an Arabic word meaning antidote. The fact that she was slowly leaching drugs back into her system put some credence to this ancient fable. Norman's bezoar was due to his use of nifedipine, an anti-hypertensive medication. He told Clara he was taking a sustained-release formulation that contained an indigestible cellulose acetate shell. Norman's smaller mass also contained undigested seeds and was classified as a phytobezoar. He regularly ate persimmons from his backyard tree. Still in the lab, Norman described other types of bezoars, including lactobezoar, caused by milk and mucin, and a foreign body bezoar that can contain paper and plastic. He showed Clara a picture from the internet of a trichobezoar, one that contains hair. He said that this was due to trichophagia, a psychiatric disease where a person eats their own hair. An extreme case is caused by Rapunzel syndrome, a large bezoar that has a long tail extruding into the intestines. Clara was grown upon seeing this image.